Today, I have chosen to speak upon the benefits of chemotherapy. Why, you ask? Because until a month ago, I had no clue about cancer. I walked around oblivious to the world where people are fighting for their lives every day. It's one of those situations where you're like, cancer has nothing to do with me, so I'll pretend it doesn't exist. Well, it has been exposed to me through an important family member. I remember the day I got that phone call. I had just moved to Odessa and was out buying groceries. The news that my aunt had cancer stopped me in my tracks. The aunt that I have tons of pictures and memories of me and my sisters wearing dress-up clothes and spending countless numbers of Christmases at her house. The aunt who with every year I grew closer and closer to and formed an inseparable bond. A bond that was so strong it did not waver when she told me that she didn't want any form of treatment for her cancer. Today I'm going to talk about the benefits of chemotherapy. Finding out that my aunt had cancer and is refusing chemotherapy and treatment altogether got me on the track to looking and researching different procedures for her cancer. She's a little older and maybe didn't understand exactly all the benefits of the treatment, so these points I'm going to make are what I would expect a doctor to explain to an uncertain patient with cancer. I will explain what cancer is, how chemotherapy works within the body, how treatment works, and some of the side effects of chemotherapy. Many people should understand exactly what cancer is. Cancer is a disease caused by an uncontrolled division of abnormal cells in a part of your body. And there are many treatments you can take to help fight off cancer, such as radiation, chemotherapy, radiation therapy, targeted therapy, surgery, and many more. I've chosen to discuss particularly chemotherapy because it is one of the most common forms of treatment, and it's like a symbol that most people associate cancer with. Chemotherapy is one of the least invasive and attacks cancerous cells directly. It helps to stop cells from dividing and spreading. And chemotherapy can also attack cancerous cells in any part of your body. As a cancer patient, you may be scared of the idea of chemotherapy because of things you may have heard or seen on TV or from other people. You can take chemotherapy at home or as a pill, and you can also take sessions in a chemotherapy unit through an IV. And some of the sessions depend on the type of cancer that you have and the type of treatment that you need. When I toured the St. Luke's Hospital in Houston with my aunt, we spoke to a patient. And she was on her last treatment and had a total of 8 sessions in a 6-month period. Now these sessions could last from a few minutes to a few hours. The Macmillan Cancer Support website described what a chemotherapy session was like. And during a session, you sit in comfy chairs and you don't feel anything during the treatment. And you are allowed to bring family or friends. You can eat, drink, read, or sleep. You could use this moment to relax. And some of the side effects usually scare people, such as nausea, hair loss, fatigue, or feeling sick. But if you do experience any of these pains or discomforts, there are things that doctors can do to counteract these effects. Increased risk of infections does happen, although not everybody experiences these pains. It depends on the type of chemotherapy that you have, and remember, everybody reacts to things differently. I also researched some long-term effects of chemotherapy. I found an article titled The Disadvantages of Chemotherapy, written by Ray Udon on Livestrong.com. In his article, Ray discussed some of the long-term effects of chemo, including heart or kidney problems, lung tissue damage, nerve damage, and sometimes infertility. Yes, these are some things that everyone deciding to undergo chemo should be aware of, but risks come with literally everything you choose to do in life. Heart and kidney problems can be managed, infertility can be overcome through adoption or surrogacy, and the chance to live a long and healthy life with your loved ones is worth the risk. Survivor Sally R. from CancerTreatment.com says she experienced mental side effects from her chemotherapy, such as a lack of organizational skills and a lack of short-term memory. She's a 4.5-year cancer survivor, and I can't really give you any statistics about the survival rate of using chemotherapy because it does depend on the type of cancer that you have and the stage that your cancer has progressed to. But I do believe that these experiences are a small price to pay for a cure and to live your life with your loved ones. Doing a chemotherapy treatment is better than doing no treatment at all. Finding out that my aunt had cancer made me not only think about my aunt's health and the well-being of